The Committee on Commissions, Statutory Authorities and State Enterprises, COSASE, chaired by the Deputy Chairperson Aaron Mayanja, met today with officials from the Uganda AIDS Commission to review taxpayers' expenditures highlighted in the Auditor General's report for the financial year 2023-2024. During the session, members of parliament raised concerns about why people living with HIV are reportedly struggling to access treatment and antiretroviral drugs.
Our villages, barriers, people seem to have lost hope, and it's going to cause a bigger problem to the country.
It emerged that a key contributing factor was the withdrawal of funding for ARVs distribution after US President Donald Trump suspended aid through USAID.
Medicines already, they are there in the stores, but part of this money has been used for delivering them to the different regions. So that's why the gap has been at the moment. If there is, you find maybe areas where there are no drugs, it is actually because of the issue of delivery.
The agents had previously invested nearly 600 billion shillings annually in HIV/AIDS interventions, including drug delivery, a service that is now defunct.
Drugs are not there because of lack of transport. That is one. Yeah. I want to get that clarity from you.
That is initially what has been the problem. But that's the gap now which government is coming in to fill in. Because initially much of this transportation of the drugs you see, the money was coming from actually external funding.
Additionally, funding from PEPFAR, the US President's emergency plan for AIDS relief, had been instrumental in establishing drug storage facilities which are no longer operational.
For the private system operated by the joint medical stores, they have a large warehouse for storing the HIV commodities, and that space is paid for by PEPFAR, by the US government, and the system for delivering these commodities to health facilities. Even that delivery system.
Officials are now urging the Uganda government to step up and provide funding for drug distribution in order to save lives.
So that we can help you. What kind of support do you need from Parliament to ensure that we help you and you seal off the gap?
But this is a provision that we actually discussed with the Minister of Finance and then Minister of Health, and that's what they agreed that will be added onto the budget.
Lawmakers got information that government agencies have been requested to include HIV/AIDS prevention in their annual budgets, including purchasing condoms and conducting awareness campaigns.
To budget how to train people how to use condoms, whether that policy initiated from the Commission or they have any clue about it.
So they do not just teach condom use. That's just one of the activities. They go a whole spectrum of teaching their staff the positives and negatives on how to live healthy lives free of HIV and its impacts, which is mainstreaming.
Currently, the Uganda AIDS Commission is facing a major funding crisis, with nearly 80% of its resources having come from foreign aid. Juma Kiria, NTV.